Hey folks, I'm Howard Lux.
I'm Jeff Berg.
We are the two boneheads, bringing you a wealth of experience, 40 years between the two of us. We're going to go on a touchy subject. You know, orthopedic surgeons are really like the family practice doctor of the musculoskeletal system because as we age, things hurt. But there's other reasons. There's other reasons why things hurt. We're overweight. We're out of shape. Um, it's not unusual for us to see someone with complaints of shoulder pain, back pain, knee pain, ankle pain on the same visit. You don't have five separate problems. You might have one or two, but should we be treating a whole patient? What role does an orthopedic surgeon have in all this? Should we get MRIs of everything? Jeff?
Yeah, I mean, Howard, we both see this a lot, and particularly we know that unfortunately obesity and sedentary lifestyle are getting more common, and so perhaps we're seeing this even more than we used to. Now, it's not uncommon. Patients can have two problems. They can fall out of a tree and break their wrist and their ankle, and they're true orthopedic problems. But without that trauma, sometimes patients come to my office and they're really complaining of a bunch of things.
Right.
And some of it, unfortunately, is lifestyle changes, which can be a little difficult to discuss with patients. But things like obesity and sedentary lifestyle are critical. If somebody's
Absolutely
not in great shape, but they're requiring their out of shape muscles and tendons to carry bigger loads, and then we always see those patients come January 2nd, start exercising. Then we get a lot of overuse problems. And it can be a tough battle for patients because they maybe want to start exercising, start losing weight and getting better health, but now they're in pain and they got to take months off. That's always a challenge, you're right.
Yeah, this is a difficult group to treat because the answer is not, knee arthroscopy in January or shoulder arthroscopy in February and low back fusion in March. We understand the complexity of pain. We're not telling you you're not in pain, and we do empathize with that. But the answer is sometimes very, very challenging, and we have to partner with you. We know that high sugar diets are very inflammatory, so we know that people are going to feel better if they stop eating this added sugar. But then it's hard to do that because big food has figured out 253 ways of naming sugar and sticking it into the food that you eat. But you do have a role because you don't have to go to McDonald's and you don't have to supersize it and you don't have to be drinking soda. So we both have a role in helping you manage this. Like weight bearing, walking, right? It's 5 to 7 pounds of force for every pound that you weigh on that knee. Have you had much success in scoping a 300-pound patient's knee?
Yeah. I mean, so it's classic for me, and I'm sure you and even most orthopedists, the patients will come in, they may be overweight and out of shape. And, what I try to explain very simply is, you're asking your body to do this much work, but it's only in shape to do that much work. And you got to flip it. So we got to reduce the work. It doesn't mean you can't do any exercise. In fact, I think you should do some exercise. But a lot of people get motivated and they jump right into it. And it's too much for their body. So they got to work on both angles. And, people be surprised. Most people you talk to, you ask them, you talk about, I think you're a little overweight. And I use that 5 to 8 pounds, whatever, multiplier. Most people don't realize exactly how many calories they're taking in a day. And you use some kind of app on your phone that measures calories or Weight Watchers where you measure calories, you'd be shocked exactly how many calories you're taking in. And if people could start to lose just a little bit of weight slowly, real critical to slowly increase their strengthening, then that's the answer. The problem is, a lot of folks have been inactive for a very long time, and they're really, really out of shape relatively. They may not know that, but they're out of shape. And their body just can't handle the new level of activity.
Yep. Yeah. Sometimes people just need a coach, and sometimes, we don't just treat people who need surgery. I'm not there to find something to operate on. I'm there to help you get out of a tough situation. And when Jeff refers to exercise and activity, there are papers that show it can be simple as walking for 20 minutes. Or parking further away from your building and not getting a handicap permit so you can park right in front. It's an effort that we call make your day a little harder. You should never take an elevator up one flight of stairs. You just have to try to get a little more activity than you're currently getting. Now, we're going to have a ton of people angry at us. So you don't understand. I really am in pain. We do understand that you're in pain. But unfortunately, there's no easy answer out there. Pain is a difficult subject unto itself. But as long as we both take an active role and help you and put you in the center and help you as an active member of your team, we can get you out of this more times than not.
Yeah, Howard, I've had a handful of patients that have been like dramatic successes. Like somebody, I can think of a gentleman I have who and you probably have patients like this too, who was terribly obese, probably like 400 pounds, in a wheelchair. And for whatever reason, he got motivated and started to slowly cut his calories and improve his strength. His calories came down and his strength went up. And now walking without a wheelchair. Now, is he a marathon runner? No, but his quality of life is better and his level of pain is better. And the problem is, and I try to gently tell my patients this, is that you've dug a hole for a very long time. And I don't have a quick way of getting you out of this. This is going to take a lot of patience. And some people, unfortunately, in this day and age, don't have that level of patience, and they're looking for a quick fix. And unfortunately, surgery actually sets you back a little further, particularly if it's not necessary. And a lot of times, sometimes I find that, patients will, maybe I'll see somebody who I kind of had this discussion with, and they want to prove me wrong and said I had surgery and now I'm feeling better. But a lot of times it's because you had surgery, you rested,
yep,
and then you rehabbed
yep,
slowly, and that's why you got better. The surgery may or may not have been part of it.
Absolutely. And then there's the placebo response.
So
we never quite know. Now, this is going to come home to roost for a lot of these people too, because let's say they have really severe advanced arthritis, and I'm considering a knee replacement. We now have an insurance company in our region here in New York that's insisting on a BMI under 35. So that means if you're 6 feet tall and over 225 240 pounds, guess what? You're not going to be allowed to have your knee replacement.
Well, sometimes that may not be a bad thing, because that person who comes in, like you painted, back pain, knee pain, ankle pain, foot pain, you know what? That the best treatment for that person may be one thing, losing weight, and not addressing each of those individual sources of pain.
Agreed. So, folks, we are there to help you. You have to want to help yourself as well. This is Howard Lux and Jeff Berg, the two boneheads. We'll see you next time. Bye.
Have a great day.